All right, 11. Acute cholangitis. What sort of symptoms would you see? They're classical. Fever and right upper quadrant pain. Can corticosteroids cause a change in mood? Definitely can. If someone has vague acute onset of flu-like symptoms, what should you suspect? HIV. All right, odd ratio. Less than 1, equal to 1, and greater than 1. What does it mean? Less than 1, exposure associated with lower odds. Equal to 1, no association. And greater than 1, higher association. Is dengue fever associated with circulatory collapse? Yes, it definitely is. What is actinic keratosis associated with? Squamous cell carcinoma. If a patient has a holosystolic murmur at the left sternal border, what should you suspect? A left to right shunt. If an abdominal ultrasound is used, okay, scratch that. What is the best test to diagnose subphrenic or an abdominal abscess? An abdominal ultrasound. A negative result on a highly sensitive diagnostic test helps rule out what? That's a trick question. It helps rule out whatever it is that they are looking for. A likelihood ratio compares what? The clinical significance of various results. Verification bias can happen when a study has gold standard testing selectively used in order to confirm a positive result, right? What is the organism responsible for tabes dorsalis? Treponema palladium. If a psychotic person who's not taking their medications is having an episode, what should you do? Stabilizing and then get them on a long-term acting injectable antipsychotic, right? If someone has sarcoidosis, what's their prognosis? Right, someone with sarcoidosis, there is a high possibility that their condition will resolve over time. What is the complication of ovulation induction? Ovarian hyperstimulation is. If someone has peripheral nephropathy, what can help treat that? Strict glycemic control will decrease the risk of progression of peripheral neuropathy. Okay, 17. Tell me more about blank is a common sort of phrase that you want to use when dealing with patients to get them to express themselves openly to this open-ended question. If you have a patient with a suspicion for cancer and they have lymphadenopathy or some suspected metastasis in a less critical area to biopsy, what should you recommend? An excisional biopsy of whatever it is, preferably like a lymph node that is not near vascular sensitive areas for the most part. How do you treat arrhythmias in a TCA overdose? Sodium bicarbonate. What's the first line treatment for ventricular rate control in patients with rapid atrial fibrillation? Metoprolol. If you have a patient that snores, what should you advise him? Advise the elimination of alcohol intake before bed. If you have a concern for a pending anaphylaxis in a patient, what should they be given? Intramuscular epinephrine, of course. If your patient has a concern for ocular melanoma, but it's minimally raised and is less than 1 millimeter, what should you do? Repeat the exam in 3 months. If you have a patient with concern for ocular melanoma, what should you do? Follow up, and if it is 1.8 millimeters, you need to treat it with radiation because it's now greater than 1 millimeter, centimeter, whatever. 1.8 centimeters, that would be, by the way. Okay. Can a minor that is pregnant provide their own consent for a C-section? Yes. If a patient has a bicuspid aortic valve, what do you want to do? Screen their first degree relatives to see if they have it as well, right? Patients with acute coronary syndrome, what sort of medications do they get? They get antiplatelets, nitrates, beta blockers, statins, and anticoagulant therapy. If your patient has diarrhea more than 4 weeks, you need to do what? Get a stool sample, send it to microscopy, check their electrolytes and fat content, right? True or false? Malabsorption syndromes can be associated with villus atrophy and decreased intraepithelial lymphocytes. That is definitely true. Malabsorption syndromes can be associated with villus atrophy and decreased intraepithelial lymphocytes. Is celiac disease likely to respond to dietary management? Definitely, without a doubt. Stop eating the gluten, man. If someone has strange headaches and they're female, they're obese, what should you do? Perform an ophthalmoscopic exam for pseudotumor cerebri. If you see a patient and they have a concern for acute cholangitis, what should you get? An ERCP, endoscopic retrograde cholangiopancreatography. If your patient is in the ICU and they have an aspiration risk with a bleed, etc., what should you do? Intubate them. How do you treat varicose hemorrhage, by the way? IV octreotide, right? What's second-line treatment for varicose hemorrhage? A beta blocker. What is toxic shock syndrome due to? Well, toxic shock syndrome is secondary to bacterial exotoxin production. IV fluid infusion and antibiotic therapy is a treatment for what? Well, multiple things, but in this scenario, toxic shock syndrome. All right, you got a kid or a newborn baby or a young baby, and you suspect that they have cerebral palsy. What imaging can you use to confirm your diagnosis or concern? Right, brain MRI. All right, so hazard ratios. A hazard ratio less than 1 means what? That the issue is less likely in the treatment group. And a hazard ratio greater than 1 indicates what? That the issue is more likely in the treatment group, right? So if you have a patient that needs to be hospitalized because of malnutrition, what is the first sort of step that you want to take in getting them back up to normal nutritional status? Oral rehydration solution, right? Okie dokie.